Hello, do you suffer from diabetes, whether it's type 1 or type 2 diabetes? Maybe a loved one in your home or a place of work suffers with diabetes and they're taking medication and they're noticing that the medications are not helping them get well. There are millions of Americans and millions of other people around the world who are suffering from this condition called diabetes mellitus. Diabetes mellitus, where the blood sugar disorder is not properly, I shouldn't say controlled, or fixed, reversed, to help somebody become non-diabetic, to help somebody bring back their blood sugar numbers to normal, where they can actually reduce their medication and even, in some cases, get off of their medication. My name is Dr. Lonnie Herman, and in this video, I'm giving you a preview to another video that I plan on just, let's say, merge with this video, where there's a testimonial video, a discussion I have with a patient of mine who came to my clinic from Georgia, who was diagnosed 7 years ago as a type 2 diabetic, and he was instantly put on insulin. As what he states, he was diagnosed type 2 diabetic, yet instantly put on insulin. And within the first 3 months here, with the work that we're doing, his A1C level, which I'll show you in this image here. I'm going to put this up and merge the picture right onto the screen. But the A1C level in this image, which you'll see put up next to me on the screen here, it shows that his A1C, as you'll be able to see here, a 12.9. And I met with him and this blood test was done on January 25th of 2017. I met with him, his first exam here was January 27th of 2017. The next exam that was done on this gentleman, who you'll get to hear his discussion with me in the next part of this video, but this next part of this exam shows that his A1C level became an 8.7. I'll hold this page up, but you'll actually see this image that I'll merge onto the screen next to me, that his A1C level, which was tested on March 28th of 2017, his A1C reduced from 12.9 down to 8.7. He followed my particular protocol. He actually, which you'll also hear him mention in the next part of the video, he had a horrible diabetic ulcer on his big toe, and he did go to the hospital. He did follow my protocol while he was in the hospital, and you'll hear about the doctor reporting about amputation was necessary for the toe. There was no way they could save it. And now the toe is saved. He still has the big toe that they were going to amputate. Now, while there was some medical intervention with the toe where they had to clean up and do some debridement, they cleaned up the images that you're going to see in just a second here. I'll put them also on my left side of the screen here. But the main infections that I found in the type of exam that I offer patients, he was able to follow the protocol while he was in the hospital, and nobody knew about what he was following. So I believe that there are two parts of the toe healing, totally healing. Again, the doctor said amputation. And now the toe he still has, he's very happy that he has his toe, and the toe appears to be healed or healing just about perfectly healed right now. And again, amputation was the only option the doctor gave him. He asked the doctor to do him a favor and see if they could take some time to see if he could save his toe. And that's how he went on a journey over the next 3 months with this protocol that I provided him from the first exam. Right now, I'm going to put the picture of the toe up here. Now, before I put this up, whoever's watching this video, please listen that this first image of this toe for the person with a weak stomach, you may want to actually stop watching this for a few minutes, because the toe is not a pretty sight. The image of this toe, which I took a picture when he was in my office on the exam table here back in January of 2017, it's not a pretty sight. There's a lot of skin that's missing, and so when I put this up in the next moment, you may want to pause this video and you may not be able to watch. So it is pretty, some people have actually gotten pretty nauseous watching this, and some people are okay with watching it. Here I'm going to put this picture up right next to me over here, and as you can see in that big toe, and if you've got to pause this and maybe you could zoom in with your computer screen, zoom in on the image, it's pretty clear that there was a lot of missing tissue from that toe, and you could see the under tissues and almost right down to the bone. It was pretty horrible. So get a good image of that. And the next picture that I'm going to put up here is his toe now, which I saw him again. His second exam visit with me was May of 2017, May 2nd of 2017. And you can see in this toe the incredible healing that took place for this gentleman. You know, again, if the debridement that was done in the hospital was the only way that his toe healed, which I don't believe at all, which I'll tell you the exam findings in just a moment that he followed in his protocol, his first protocol. And I'll also mention about a second protocol, and I'll also give you all some information about some real research that's going on in the world that's actually listed in diabetes journals by the American Diabetic Association as to various types of some of this that I'll give you is that there is research that you just may not be aware of, that your endocrinologist or the emergency room or the other doctors, general care practitioners that you see for your care may not be realizing or may not even notice that's out there in the research papers that are out there and the research studies that have been done about diabetes. But you see this picture now, this toe, how healed the toe is, and it's still healing, and it looks, you don't see an open wound there. You don't see the amputation that was recommended to the patient. You also hear him talking about this in the next part of this video. But where you see this toe healed, it's incredible that if what was done in the hospital was the only thing that healed him, why would the doctor not recommend to try something else instead of telling him to amputate the toe, which they made very clear. Two physicians and his own family members had a discussion with him to amputate the toe. And you can see that the toe is healed. So if their medical procedures were the only steps that healed this gentleman, again, which I don't believe so, and I'll tell you in just a moment what I found and what he treated him with, but the recommendation of amputation never would have been provided to the patient. He's great relief from his condition and how he's happy about the toe and about the blood sugar in this next part of this video. When we come back after his discussion with me, I'm going to share with you the results. Okay? So get ready right now. We're going to watch the next part of the video, and then I'll be back in just a moment. Hi, I'm Dr. Lonnie Herman. I'm with a great patient of mine. This is Mr. Shabazz, and he came down from
Atlanta, Georgia.
Georgia. We're down here in my clinic in South Florida, and this is his second exam visit with me. So we've got a few topics to discuss. This will be a very brief video, and there'll be another video that I'll present afterwards. I'll say another video that I'll make a bit later on about what I found in his examination that brought us to this point where we are today. But he is a type 2 diabetic.
Right.
And you've been insulin dependent from the first day you found out that you were diabetic.
For about 7 years.
7 years ago, and there was no medication of any kind. I mean, there was no pills.
No pills.
It was insulin right away.
Right.
Yeah, so there was no even take pills first. He was automatically a type 2 insulin dependent. And you've been taking the insulin every day for the past several years.
About 7 years.
And another condition that he came here for was neuropathy with the hands and the feet. As well as he had a much even more serious condition that developed where he was about to lose his toe, his big toe on his left foot. And I have pictured this. I'll try to. They're pretty graphic for some people. It may be a bit too graphic, but we'll be able to somehow merge it with this video here and let you see what was then and where it is now, which is quite amazing. Mm-hmm. So the big toe on the left foot as well as the middle finger on his left hand. I'll tell you right now, let's get into what the toe and the finger. The fingernail was just lifting away, and it was a very infected looking fingertip. The toe, when you looked at the big toe on the tip of the toe, this area of the toe, it was just peeling away. You could see all the tissue underneath. The toe was swollen, as well as the top of the toe right behind the toenail. That was shortly after you left here on the last visit, which is back in January. This is May 2nd of 2017. You were here in the middle, towards the end of January of 2017, right? So in one protocol, we've had great changes, but even after you left here, the top of the toe had just burst open.
Yes.
So let's cover one point, first of all, the diabetes. With your using the insulin over the past 7 years, what was your average A1C number with all the insulin use?
It hovered around 13.
13. Did it ever go, let me just say, hovering around 13, did you ever get a test score where it showed that it was below a 12?
It never went below 13.
Never went below, well, the test that we have was 12.9, which is
Right.
pretty much close to 13,
13.
but never below that.
Never
Never below that. With as much insulin as you were using, it never went
Yes.
below. Right now, we see his blood sugar, I'm sorry, his A1C went down to your most recent reading in your blood test was
8.8.
8.8. And you were still taking the insulin. What were you going to say? I'm sorry?
No, I was going to say before then it went down to a 10.
Yeah. So in between, so we went from a 12.9 is what I have record of here, which
Mhm.
you're calling it a 13, but 12.9. It went down to a 10 between the January visit and May now.
Right.
And just a week ago or so, or 2 weeks ago or so, you had a test done, it showed 8.8.
Right.
And we're down to 8.8 following this protocol that I developed for you. And there was nothing else that you did different besides following a healthier diet.
Right.
But there was nothing else that you did different.
No, I
right?
didn't.
Also, besides going from a A1C of a 12.9 to an 8.8 in this period of time, you were, when you left here, you got so, let me just say, frightened. You were very uncomfortable that the toe had burst open, even
Right.
worse than what it was than when I saw you. You decided to do what at that time when it just opened and it was pussing?
Well, I went to the emergency room.
And what was the first thing that they said when they saw the toe?
They asked me, what happened?
Mhm.
And they admitted me. Well, after I told them I was a diabetic, and they admitted me, and the doctor, they had a foot doctor come in and look at my toe, and he decided right then and there, cut it off. There's nothing he could do, or no one he knew or he could recommend to do anything for that toe.
Nobody who was even more special, who had a greater talent or a better understanding of your body, who could say we could save the toe. It was impossible.
Impossible.
Impossible. And you even had a family member come in?
Yes, I had sisters. I had 3 sisters. One was in the medical field, she's still in the medical field, and she decided, like, yeah, that toe is dead. Yes, you need to go ahead on and cut it off.
Mm-hmm.
And I was like, nah, you can't get that one.
Mm-hmm.
So, anyway,
But they kept you there for a month and a half in the hospital.
right,
They kept prepping it, cleaning it up.
exactly.
But they were doubting you could ever get better with it. They were doubting you could ever fix your toe.
The doctor was like, we'll just keep him here to clean it up. And
Second. When they, you followed my protocol secretively, you followed the protocol. In the
yes, I
hospital.
did. I kept on the protocol while I was in the hospital.
I remember talking to you on the phone. You called me
Yes.
2 or 3 times we spoke, and
Yes.
I remember in the beginning it was like, do you think this can really work? Can I save my toe? And what should I do?
Yes.
I mean, it was just, it's a tough call. I didn't say
Do-
don't follow their advice,
Right,
but it was, you have to make your own decision, basically. And you decided to give it a shot. And right now, what we see, well, before I even say what we saw, what did the doctor say as you, what was going on? Tell me about a month or a month and a half into the hospital stay. What did they tell you? And they never did surgery. There was no
surgery,
stitches,
no
nothing
stitches, no nothing. They just prepped it and
Yeah.
kept it clean.
like that. And so you, what did the doctor say eventually after a few weeks of being there?
Well, after a few weeks, they moved into another room, and he eventually came to the room, wanted to look at it, and he said, wow, the toe has really improved. He said, wow, you knew better than I did. I said, no, I didn't know what better than you. I said, I just didn't want to lose my toe.
Right.
And he said, yes, it has improved a lot since the day I came in there.
It's amazing.
Yeah.
I mean, amazing to see what I see now with this toe. It's just amazing.
Yeah, I think he was thinking the same thing. I
Yeah.
think he was just in shock, like, wow.
Yeah, because that's unexpected. Because right,
Right.
away they're just going to cut it off. It's
They was gonna-
amputation of the toe or amputation of a limb, where they see the kind of gangrene,
Mm-hmm.
what was going on in there. With the findings, what we have with these targeted remedies, you were able to go after what was in these tissues and help yourself clean it up. And that's nothing that they could ever expect, even with any kind of medication that they could ever try to prescribe or antibiotics or so. Now, we did work with them. I mean, they did give you an antibiotic as well,
Right.
but they didn't think that could even be a hope.
Right.
There was no chance. There was no prayer. There's not one chance that they thought you could ever save your toe
Right.
with this. But they didn't even know about us. They have no idea about this. But
Right.
no matter what they could do, there was no way that you could save it.
But the antibiotic was just basically to keep it from getting the infection going up in my.
So they thought.
So that's all the antibiotics did. I mean, it didn't really to me, it didn't heal the toe. It was just there to
to try to
keep
stop it
that
from
wound,
spreading.
yeah, keep that from spreading.
But
Exactly.
it already had been in the finger. It looked like the same thing was happening to that middle finger.
It was, yes,
Yeah, but that finger looks like it's almost perfectly healed.
yes. It's
The toe is sealed up. I mean, the skin is grown back together.
Mm-hmm.
It looks, the nail is growing back in. It's quite amazing. This is awesome.
Yes.
Almost the impossible feat has happened. And again, type 2, insulin dependent, from a 12.9 to an 8.8 now. And the toe is not amputated. The finger is healed.
Healing.
The healing, I mean, it looks almost 100% normal to me. The toe, you see the skin is no more broken apart. It is healed. It's still a little bit swollen, but nowhere near what it was. And they didn't have to cut it off, and they released you and said, wow, basically.
Yes. Said, just go to wound care, have it
Dressed and clean.
dressed and
That's right.
clean, and
Keep
that's
clean.
it. Mhm.
How awesome is that? You're pretty happy?
Yes.
High five, man. You got that toe. This is awesome. Thank you for sharing, helping me share with people. We can do different things. It's not a miracle. There's pure science when we can actually find what's in the tissue that's causing the brain to not control the pancreas, to cause the skin to not be able to heal properly. There are specific infections to regulate the pancreas function, the beta cells in the pancreas to control their function, regulate them. This is not treating diabetes. This is finding why the disease progresses. We're finding the chronic infections and the toxins, including cancer-causing and disease-causing insecticides and pesticides and different kinds of bacteria and so on that are causing the disease of the tissue. When you can find and remove these disease-causing agents from the tissues, we can see the body heal itself. Your body healed itself. Nobody did it for you. Your body was able to do it because you took away what was causing the disease, the breakdown of the toe, and so on. So we're pretty happy. And
I am.
now the neuropathy that he's got, it's only a pinch less in the hands and the feet. What I mentioned earlier, the neuropathy, just a slight bit less, but now we're on our second protocol, and that should, hopefully in this round, all be wrapped up and be able to heal. Maybe not. Maybe there's a bit more that we have to do, but the job can all be done. So, I mean, right now we've had an amazing outcome from the first round.
Mm-hmm.
Pretty good?
Yes.
Yes. So you can call our clinic here if you'd like to make an appointment for this kind of work I'm offering. The phone number here is 954-370-3100. And you can also, I'll leave an email address at the bottom of the screen where we'll have to, if you can't call or you live in another country, people come from around the world literally into this clinic as well as across the U.S. You can send an email to my assistant and she'll be happy to answer some questions and help you set up a consultation first, and then we can move into the next exam and get you some great results. Thank you.
So you can see how happy this gentleman is coming back after he was able to discuss about after his toe, now that he has his toe, and that his blood sugars look better than they have in 7 years that he's been on insulin. In 7 years, he states there that his blood sugar never came down below 13. His A1C, that is, never below 13, which I reported to you at 12.9. He rounded up to 13. But here we are looking at this. This new test shows 8.7. Amazing. And the toe is still there. And it is healed. So I'm going to share with you what I was able to find and provide him with these specific remedies. I won't get into great detail about that, but about how the remedies are done and exactly how I do my exam, which we can save for a consultation with you. But I'm going to tell you right now, he had a horrible infection of what's called Treponema pallidum, a very destructive bacteria that was in his lymph system. It was the same bacteria in his hematopoietic stem cells, the cells that make the blood. He actually shows that he's got a low in his his March of 2017 report. He has signs of anemia. He's got a low hemoglobin and a low hematocrit, which shows that the blood count is not normal. The oxygen supply to the tissues is not normal. Well, the stem cells, the hematopoietic stem cells, make those red blood cells. So is there a possibility that since the infection in those stem cells, which was being cleaned out, is from these remedies, is part of the reason why the low hemoglobin and low hematocrit? Yes. I also found that in the embryo stem cells, the mesenchymal stem cells, the same Treponema pallidum. In his reticuloendothelial system, which makes up the whole body, all the connective fibers, all of these reticular fibers, they're called, which make collagen, which keeps skin healthy, which keeps nails healthy, hair, nails, skin, other tissues healthy, as well as in the reticuloendothelial system, we have blood vessels, the capillaries, the arteries, the veins, all infected with the Treponema pallidum. His skin showed a massive infection with the Treponema pallidum. The fascia, which is the tissue underneath the skin, massive infection with Treponema pallidum. His veins also infected with the same bacteria. The cartilage in his body infected with the same bacteria. The white matter of the nervous system infected with the same Treponema pallidum. His kidneys infected with the Treponema pallidum. The bone marrow, his islet cells in the islets infected with the same Treponema pallidum. The pancreas as well infected with the same infection. The islets of Langerhans are cells within a very small portion of the pancreas, because the pancreas does two things: produces digestive enzymes as well as producing hormones. One of the hormones out of these islet cells is insulin. Another hormone we have called somatostatin, and another hormone is glucagon. Well, somatostatin, which you may or may not have heard of before, but somatostatin actually plays a role in stopping the insulin release. Because if too much insulin is put into the body, you can get a low blood sugar. So the body has its own balancing mechanism where these islet cells that let out the insulin, we also have somatostatin that puts the brakes on the insulin release so we don't get a low blood sugar. Because in your brain, you have a specific tissue, which I'm going to talk to you about in his next protocol, which I discovered when I examined him in May of 2017. In the brain, you have a tissue that governs the function. It controls the pancreas. It controls the islet cells. And there are research papers that I'll put up here to prove my point. Okay, you'll be able to stop, pause, look up this information yourself, that the hypothalamus has glucose sensors in it. You know that glucose fuels the brain. Well, the hypothalamus of the brain, again, I'll put that name hypothalamus next to me on the screen here. The hypothalamus has glucose sensors, and the hypothalamus actually regulates pancreas and islet cell function. That there is research that has found when the hypothalamus is inflamed from different infections and toxins, not just diet-induced hypothalamus inflammation alone. You can have diet-induced inflammation and dysfunction of the hypothalamus, which can cause dysregulation of the function of the pancreas and the islet cells. You can also have inflammation by infection and toxin, food, preservatives, insecticides, pesticides, anesthesia chemicals from previous surgeries, Novocaine chemicals from previous work in your body, dental work or somewhere else in the body, mercury from your teeth, mercury from vaccines, mercury from fish, mercury from the ocean. You can even have various other kinds of toxins as well as infections, including but not limited to various kinds of bacteria, whether it's sexually transmitted bacteria or not. Even if the infection came on through interactions with another human being 20 years ago, 30, 40 years ago, the infection can grow over time and spread to different parts of the body, including the hypothalamus, including the islets of Langerhans, and cause you to become a diabetic. That's the reality here. It's not just out of the blue you become diabetic. Something is in the body causing it to happen. So the hypothalamus regulates the pancreas. The hypothalamus, when it's malfunctioning, the pancreas will also malfunction. The liver can malfunction. There are studies which I'll put up here where they notice that when the hypothalamus was inflamed, when they actually provoked inflammation of the hypothalamus through studies in the lab in rodents, that there was a direct correlation to excessive blood sugar, that there was excessive release of blood sugar from the liver. So in his second test, the hypothalamus, he had organochlorine pesticide chemicals, codeine, an insecticide called malathion. He had parasitic infection. He had the insecticide called DDT. Also, he had various stress to the blood vessels with the hypothalamus. Now, again, when the hypothalamus is malfunctioning, the pancreas will malfunction. The hypothalamus also lets out a hormone that the islet cells do as well. It's called somatostatin. So when the hypothalamus is malfunctioning, could we have excess somatostatin being released? What somatostatin does is it decreases insulin release. There was a study could somatostatin release actually cause a decrease in insulin? Will it cause a decrease in C-peptide levels in a person's test? Well, the these scientists did a study with horses, which I'll put that article up here on the screen, but they did a study with horses where they measured their blood, they found that they had normal C-peptide, normal insulin, normal glucose levels. They took the hormone called somatostatin and they injected these horses, and they studied their blood again, and they noticed that they had now a low C-peptide level, which then equals a low insulin level. Again, they injected somatostatin hormone into these horses, and when they tested their blood again, they had a low C-peptide level. So could an individual who's called type 2 diabetic, could that individual who has a low C-peptide, could that individual actually have too much C-peptide coming out of their pancreas? Could they have too much C-peptide coming out of their hypothalamus, where that C-peptide is actually causing a decreased C-peptide? It's a possibility. How many of you have had your somatostatin levels tested? How many of you? I haven't seen that yet with patients when I'm seeing my patients who come in here from around the country and from other countries for their diabetes, that they've had somatostatin levels tested. Well, the research is clear that when somatostatin levels lower insulin, it also lowers C-peptide levels. So wouldn't it be great to have somatostatin tests done? Now, because we can find what's in the tissue like this with the hypothalamus, that can cause maybe it has too much somatostatin. And just maybe that when you look at the laboratory range for somatostatin, that there is, you might be, or your body might be actually, let's just say that there's 0 to 30 is the range. 0 means none, and 30 means the highest end of what the lab says is normal for somatostatin. And let's just say that your level comes up at 24. Maybe your body says that the normal amount of somatostatin for it to run itself normally, for it to run and control its blood sugars and so on, and C-peptide levels normally, maybe it's 15 is the cutoff point, not 30. So if you come out on your test at like a 21 or a 24, could that mean that for you as an individual, that's too much somatostatin for your body to regulate itself? Maybe. Maybe there is a certain functional range for you that's different than every other human being on the planet, because you are a unique person, not just a pooled range of this somatostatin level. So if you have a somatostatin at 24, at 21, at 20, and if your cutoff point is 18 or 15, and there's too much somatostatin for you, that can lower your C-peptide level. Does that make sense? Very simple. Go back and read that article I'm putting up here. In this gentleman's body, his liver, his pituitary gland, he had DDT insecticide. He had other insecticides and parasites and protozoa in his liver as well as in the pituitary gland. The pituitary gland gets the hormone from the hypothalamus, and the pituitary releases that hormone into your body. Okay, so the pituitary gland can be part of the puzzle here. I also found with him in his islet cells on this visit a small amount of that treponema pallidum left over. And there are some other findings here that are on other tissues that may be like you or other patients, or not like you, like the portal vein that goes to the liver, he had infection. And there, in certain cases, in certain patients who I meet with, where they have emotional stress, they get emotionally upset, they get angry, they cry, they get very upset, that they actually have higher blood sugars from the emotional stress. So it's possible, like what I found with him, that there were pesticides and infection like candida in the emotional centers of his brain with this very unique bioresonance testing. I do here again, another video, or on a one-on-one with you, I can describe this. Or if you have a group of people you want to get together, so I can describe what I'm doing and how I'm finding these findings, and being able to provide remedies that will remove these infections and remove these toxins from the tissue, so we can stop the tissue from being diseased, so that tissue, the hypothalamus, for example, or the islets of Langerhans, can actually regulate what they're supposed to do to regulate all the functions coming out of them. Very simple. When we can use a remedy to get rid of the infection or toxin inside the tissue and help to boost the function of that tissue, that's when the tissue can function normal again. That's what I'm presenting to you. Okay? So there's other research I may put up here, maybe during this video on my left side here, or right at the end of the video. I may cite some articles that I don't remember right now. But the point is, find the infections and toxins with this unique work that I'm offering you, so you can actually remove those infections and toxins very safely, and you'll be able to, like this gentleman you saw here, whether it happens in 1 round or 2 rounds or 3 rounds with me, or it takes us a year, whatever it is, that you can actually start to remove the causes of your condition. infections and toxins can get into these tissues without a sore throat, without a cough, without a fever. They can be inside the pancreas, causing the pancreas malfunction. They can be inside the brain and the hypothalamus that regulates the pancreas, causing pancreas malfunction, causing diabetes. That is what I believe. That's what I see. And to see results like this with the lab images that I showed you, these pages that I showed you, you can start to reverse this condition. There are other videos I put up here of people who are getting well. Some people don't like the information I'm putting out. Some people think whatever they want to think, but I'm going to tell you that when you want to get well, when you want to try something different, when you want to actually have real steps that can provide you real answers to give you steps towards helping you reverse your condition, this is where to come. Go back and watch this video again. Look up those research papers that I put up here. Call my clinic for your appointment, 954-370-3100. You can even leave an email at my my clinic assistant's email address. I'll put that up here. Send her an email and she'll get back to you and help you set up your appointment and get started with this care. I will say this ahead of time, so it's not, it's just so you know this before you call or email. This type of care that I'm offering is very unique. This is not insurance approved treatment. They do not recognize this kind of work. While they do recognize a regular blood test, while they do recognize getting your insulin or your diabetic medication or your blood pressure medication and so on, they don't recognize this type of work I'm offering. So you will have to invest in yourself in the type of work that I'm offering you for you to help yourself start to reverse this condition. And again, it may be very quick for you. For some people, they'll heal faster than others, and that's just the way it is. I can't make everything just disappear overnight for some people, and that's just what it is. But we can help you get on the journey, start helping yourself get well. Okay? Again, you can call or email my clinic. I look forward to helping you. Watch this video again. Share this video with a friend or a loved one. Go to my Facebook page, like my Facebook page. Come to my Instagram. I'll put the addresses here on the screen. On my Instagram, like me on my Instagram, follow me on my Instagram, follow me on my Facebook. I put up information there all the time. Subscribe to this YouTube channel. I've got a lot of videos here. Scroll through some of these videos. Listen to the different discussions that I provide for different kinds of conditions, including but not limited to diabetes. I'm here to help you. Share this video. I look forward to seeing you soon.